everyone. I'm Dan Carr, and I'm here with my colleague Sean Duffy. And on today's webinar, we're going to be discussing generating revenue, finding growth opportunities in a stagnant market. I'm sure that doesn't sound like anything that would be relevant to what's going on in healthcare right now. I feel like we should probably start by defining what is a stagnant market. So, for the purpose of this webinar, when we're talking about market stagnation, we're referring to prolonged periods of flat or minimal growth. Obviously, there can be a lot of factors, but we're primarily looking at a lack of information available to properly identify and target market opportunities, which is kind of what we do over here at Doctivity. We'll also then show you some of the dashboards and healthcare like tricks and tips that we use, but of course, there's lots of ways out there to gather the information that we're going to be talking about today. So learning objectives, things we were hoping you'll take away from this session today. Causes of market stagnation in your specific market, how to do an operational assessment of your current business and to find your baseline. Sean will talk on baselines more. That's one of his favorite things to talk about, and it really is very important to kind of know where you're at so you can map out where you're going. Determine the usefulness of your data and then how to use that data effectively for targeted growth. Finding that low-hanging fruit. I know I'm not a big fan of using terms like low-hanging fruit and synergy and all those business words that we like to overuse within our healthcare industry, but it really is a good way to describe the things out there that can turn around and give you really good, quick ROI. And then we'll discuss tactics, how you're going to take all this information that you're gathering from us and then implement it and actually generate ROI for your own organization. So without further ado, I'm going to pass it off to Sean, who has a lot of experience in this stuff. Go ahead, Sean.
Oh, thanks, Dan, and a pleasure to be here today. So, the big question here is what is happening in your market? Why are you seeing stagnant growth from markets that historically have been, productive? Ultimately, we're seeing a major shift in the landscape of healthcare. Large health systems or hospitals are acquiring smaller hospitals, which ultimately results in provider alignment. So, in years past, you may have had opportunity from large groups of independent providers in a particular market. Now they are all employed, really aligned to a specific health system or hospital. Really that changes the whole dynamic because you used to have the ability to develop those relationships in the market. You saw splitting dynamics where, there may be providers who refer 50% here and 50% there. Now that's really tightened up, and really trying to grow from that particular market becomes a little bit tricky.
And sometimes, Sean, when you acquire new PCP groups, they might not even be aware of the specialty services that exist within the new system that they've been acquired by.
Yeah, without a doubt. So, it's almost like a re-education process, and really, you really have to understand what's happening behavioral wise from those providers. Are they still referring to you? Are they being pressured to keep patients in network? And we'll get into that a little bit more around network integrity. But ultimately, aside from some of the grander things around the business of healthcare and regulatory pieces, what I've seen as a major, sticking point with stagnant markets is that alignment within a market. So really, we want to focus our time there today. But then we also want to talk about, how do we grow? Here are these markets closing in. So what are the steps that we need to do in order to grow from that stagnant market area? Number one, and I'm really biased to this, is really for every organization, you must take a self-assessment. You really have to inventory your own business, what it is today. Are you ready to actually grow? Because I think it's really important, over promising and underserving is a major problem in healthcare today, supply demand dynamics. But ultimately, where I think you need to start is low hanging fruit. When you talk about revenue generation growing, there's probably a lot of opportunity within your four walls and you don't even know it. So why do I state this? Because I think every organization, if you're going to be successful, you really have to understand your own operations. Are you operationally ready? What are the baselines? What are we working from specifically in those priority service areas that you need to grow? let's face facts. Every year we sit in budget meetings and you know, they're aggressive and, you know, clinical leadership, they're held to the fire for their budgets, hitting their budgets. The question is, are you ready to grow? Can you meet those aggressive goals? Number one, and I'll just pull out some knickknack type items that are really important. You know, within your own service line, you know, what's your overall provider template utilization KPI? Are your providers hitting the mark? Are they built to grow? You know, from a scheduling perspective, a template build. Is there enough new slots versus return slots? Same day cancels and no shows. You know, there's revenue just sitting there. Are you equipped to address that major dynamic in healthcare? I saw an interesting statistic as I was researching a little bit. $150 billion is lost due to same day cancels and no shows in healthcare annually.
Wow.
That
I
is,
would say that's
I mean,
surprising, but it's actually not surprising from what we've been doing for so long. Yeah.
exactly. So, you know, I've had the experience in sitting in clinical operations, and really, that is a statistic that you don't look at every day. So, how do you combat that? Are you planning strategically to meet that dynamic, because it happens in every hospital system without a doubt. You know,
This kind of goes back to your low-hanging fruit, the stuff we're talking about here. It's not rocket science, but you can't get overwhelmed with looking at the big picture and not drilling down and seeing these easily attainable things that you're talking about, Sean.
that's exactly right. And really, when you go over it with fine tooth comb, is really looking at trends in those no show and cancels. Is it a certain time of day? Is it a certain day? And how do you overcome that? What's the plan to overcome that high no show rate? Well, how about double booking slots? Um, Odds are, based off of the data that we're looking at, you know, this is the time of day and these are the types of patients that are no showing. So let's double book slots for our providers. The
And this
providers
all
may
goes
not
back to you
like that.
talking about you talking about baselines, though. This also goes back to knowing exactly where you're at, so you can even map out where you're going. Right? Like if you don't know and have the data to see where you're actually at this point in time, it's really almost a waste of your time, right?
That's right. And you know, again, the topic of this conversation is how you grow in a stagnant market. The growth is right there within the four walls in some cases, and you have to really pay attention to these little tiny pieces of your operation to ensure that you're maximizing on the revenue capture. Um, you know, and some other incidentals. I think, you know, from a surgical perspective, are your surgeons appropriately assigned OR block time? Are they utilizing it appropriately? What happens when a procedure cancels? Is there another one to fill the slots? Most organizations are really good at this because that's where the revenue's at, right? But it's another one of those checks and balances dynamics that you need to pay attention to. And I think perhaps the greatest opportunity for any organization, especially if you have a large employed group of physicians, is your own network integrity. You know, utilizing quality data is critical in this exercise. Yes, you have your own internal data sets, but you know, I know some of my colleagues are probably sick and tired of hearing me say this, but you invest a ton of money in data, but you're still information poor. Why is that? It's because data lives in silos. 1% of your organization's using 100% of the data. That's a problem.
Yeah.
And especially looking at network integrity, how do you get that data to help you identify where your opportunities are there? So really aligning yourself with quality data is important in all of this, aside from your own internal data sets. Um,
Yep.
with Doctivity, it's great because we align our data built from the experiences that we had to help us streamline and those insights to make them actionable.
Give us
So,
that one-stop shop, Sean. Oh, and since you mentioned network integrity, you also always like to mention across the entire continuum of care. Did you want to touch on that as well?
Yeah, I think that's really important, and I appreciate you bringing that up. So, the care continuum, what happens to a patient at point A to Z along that care continuum? I always like to use spine as a perfect example. If a patient is in primary care and is being diagnosed with back pain, every primary care physician has a patient that comes in with back pain. We all know that. But what's happening after that patient's been diagnosed with a back problem? Where are they getting their imaging? Where are they going for conservative care, whether it be in pain medicine, physical therapy, or physical med rehab for trigger point injections? Following those patients, are they staying within that network that
Right.
you've built?
Or are they
Um,
leaving at some point, or are they jumping in and out? Right. Yeah. Understanding that whole journey is very important.
exactly. And listen, once a primary care physician refers a patient through that care continuum, yes, they have control of the patient, but typically, you may see that that specialist is going to control the patient beyond, especially if they go to surgery. So that's just a sampling of what I mean by integrity along the care continuum. But, another thing you have to really understand, and it really comes into the understanding the market gaps, supply and demand, um, you know, is there services available within your market? So if you see in your integrity measurements, um, a provider's 50% loyal to your spine surgeons or to your providers. Um, you know, why are patients leaving the network? Well,
Right.
it comes down to assessment.
And this
One,
is something you
utilizing,
probably have to keep reassessing, right, Sean? You were talking at the beginning about, the shakeup in healthcare and smaller systems being acquired, or in some cases just going away. And when you find these dearths of services now suddenly where there used to be some, you need to be reevaluating constantly, I would think, to see if
yeah,
these are services you can be, filling in for, right? So,
absolutely, absolutely, and there's a lot of resources available that can help you in this process. One is data. What's the market look like from a data perspective? Am I seeing gaps in care in a market? Are patients leaving a market and going, exceptional distances for care? That's an indicator that the market is underserved by a particular specialty or service, right? And it's really the ability of a organization to kind of pivot, identify those particular opportunities. Is it creating a clinic, walk-in clinic? Is it an acquisition of the primary cares in that market? There's a number of different factors that play into this. Is it creation of outpatient services in a given market to really capture those patients at point A? I'll share a quick story, and I think it's relevant. Working with one of my clients currently, and there was a question in a particular market. They saw a decline in breast cancer patients, and they didn't know why. And utilizing data, we quickly went in to say, yeah, we're seeing that this particular competitor of yours is capturing the market in breast cancer. Well, why is that? The primary care physicians, yes, they control their patients. And when you talk about breast cancer, what's point A in breast cancer? It's a woman going for a mammography, for mammography, and what's happening in that care continuum. And you know, in women's health, women typically choose their women's health provider. And in this particular market, what we saw was that the competitor had 4 times the number of OBGYNs in the market than this organization. And yes, primary cares do control the bulk of the care, but those women are choosing their OBGYN, and those OBGYNs are providing those annual checkups, and women are getting mammography.
yep.
And ultimately, what's happening is that OBGYN was controlling the care continuum after a positive diagnosis for breast cancer. So they were utilizing their medical oncologists or radiation. They were using their surgeons. So
Which is
quickly,
exactly what you would expect to be happening, right? Yeah. So,
absolutely. So really pointing that out in data showed my client that, hey, you're underserved in this market with women's health providers. They're
Right. And this is stuff they
controlling the,
probably weren't seeing with their internal data, right, Sean? Because this is where you might need outside claims data or a visualization tool to show the stuff that you're not getting internally, right?
without a doubt. So,
Yeah.
having the ability to look at the market from a 360-degree angle versus 45 to 90 from your own internal data sets, you know, ultimately now you can start turning that out migration or that lack of integrity and understanding what's the impact from a revenue perspective. You know, what's true north in the market because they're underserved with OBGYNs. 100% is no longer true north in terms of integrity. It's probably about 50%.
Yep.
So you're getting what you're paying for because you're lacking a specific service in the market.
Right. And
That is
does
a
that loss of revenue justify them expanding and hiring a few more OBGYNs or not, right? But it's an access issue and it becomes pretty evident when you have the data right in front of you.
without a doubt. And aside from data, I think, let's talk about the data for a second. There's quantitative data, which, claims data, internal data sets, EHR, referral data, but then there's the qualitative data. And a lot of organizations that we work with and have experienced have a physician relations resource within their tool belt. And these individuals are critical because they're the ones with the voice in the market. They're the ears of your organization in the market, and they're having conversations to
Yep.
understand perception. If you see a provider at 50% integrity, you can't point a finger at them until you have a conversation to understand the story behind it.
Absolutely. Yeah. You have to go and have the conversation. It is that simple. And that piece can't be removed from this dynamic. It really can't. So
That's right. And the combination of good quality data to point you in a direction to understand the market, but also having a physician relation component who's gathering that intelligence from those providers, um, goes hand in hand with good data. And the critical part about this though is what are you doing with it? Once you identify the opportunity, what are you doing? And ultimately that goes up the ladder into the C-suite, and whether it be capital investment, recruitment, et cetera, to help you offset that low integrity score.
yeah, we could do a whole nother webinar on communication breakdowns after the boots on the ground have the conversation with the provider. The provider says, hey, I have to refer outside of the network. There's no access. They go back, they tell, one person above them, and that's where that information dies, and then nothing ever happens. So we have all kinds of tactics and things we could talk about all day on solving, top-down communication with a better form of horizontal communication. But I don't want to get sidetracked on that.
Yeah, without a doubt. So I would like to touch a little bit more. What are those other miscellaneous pieces, that you could be focused in on or thinking about when it comes to that stagnant market? Market segmentation is the next best thing when you need to grow. Um, and that takes many shapes and forms. But what I would say is really honing in, understanding what your priorities are, whether it's 4 or 5 specific services that you're really focused on growth. Um, and then peeling back the onion in the market is really understanding patients being diagnosed with specific diseases and good data sets like you have in Doctivity that you could really pinpoint a market by specific diagnosis. Maybe you're focused in on where are all the type 2 diabetics being diagnosed in the market at the primary care level, is ranking a market top to bottom 1 through 100 with the top primary care physicians in the greatest population of type 2 diabetes. Or that spine example I provided, who are the busiest primary care physicians in a market and who's diagnosing the most back pain? You can prioritize, create those target lists, and have constructive conversations honed in on those top 25 within a given market.
Yeah.
Um,
I mean, you
So
often talk about profitable services too. Just because you're not, getting a certain percentage of a market share for a particular service, maybe you don't want to invest in trying to gain that part of the market because it's really not, the margins aren't there. But maybe like you always talk about surgery for cancer. Maybe you don't want to try and capture that because it's leaving your market, but maybe because people don't want to travel for infusion or for radiation, things like that. Maybe those are the services that are more profitable that you build out, you know, close by so that you retain that piece of it. Yeah.
yeah, without a doubt. So again, market segmentation, it is a broad topic. Um, you know, from baseline simple stuff like spine, back pain to patients with heart failure who end up going down to a city for an LVAD procedure when you actually have an LVAD surgeon in your own market. So really honing in on disease states, specific patient populations, and that's all available through quality data that's
Yep.
aligned to attack that. So, again, this is a broad topic. I think we could go on and on, Dan, about our experiences in this space.
Yeah.
But, you know,
And it
what
can be
are
an
some of
overwhelming
those simple,
topic too, if you're asked to go just fix something, right? And then, but when you actually drill down and take it piece by piece or service by service, or demographic by demographic, it becomes much more, uh, bite size, something that you can actually see, things you can move the needle on, generate ROI pretty quickly.
yeah. And the last thing I will say, from a miscellaneous perspective is every health system, every hospital, every clinic has an extraordinary amount of debt that they haven't collected. So patients with copays who say bill me, and or patients who have a procedure and they're paying that, you know, paying some stipends every month towards that. Um, there's millions and millions of dollars out there of uncollected copay and debt. So that's another way to really hone in on growing in a stagnant market. It's taking care of your own shop, making sure you're maximizing on that revenue capture. Um, and last thing, I think as we look forward into the landscape of healthcare, what's next? AI is a huge dynamic in healthcare today.
True. Yep.
And what does AI mean? Um, you know, it's
I think a lot of
really
people are asking that question, Sean.
me too,
Yeah.
and I'm not not overly versed in AI yet. However, if you think through how AI can help an organization stay afloat, it's really divesting. Taking uh, you know even FTE dynamics that are happening. How is AI working together with your employee team? Scheduling, debt collection, coding, all of that dynamic happening. And in our space, in the data space, it's really organizing data even better and even more strategic and targeted. And that's what you're
Massive
seeing with
amounts of data, massive amounts of data that it can just process so much quicker than we as human beings ever could. Yeah, absolutely.
yeah, without a doubt. And these final thoughts and takeaways. Again, Dan and I just touched on a few items here today and generate some ideas for organizations. And maybe they're not new ideas. I think that everybody has a finger on the pulse of their business. But my experience tells me if you're searching for revenue, look within your own shop. And,
Yep.
and once you're ready to grow, then utilizing quality data to align yourself to opportunity in your markets.
Yep. I think you've said it throughout the whole presentation. Just you can't really map where you're going until you have a good baseline of where you're currently at. And so just finding that baseline and knowing this is where we're starting from. So then also measuring your results as you use tactics. Not every tactic is going to be a silver bullet for solving whatever problem you have. But if you don't have good data and you're not measuring your tactics, you're never going to actually see any kind of progress. It's just kind of like throwing a cup of water into the ocean, Sean. I mean, expecting it to
Yeah.
not be salty. So
And the last thing I'll say is always baseline.
Yeah.
understand your current position, build your goals and objectives around, those top priorities, and then be able to measure, how are you doing, whether it be quarter over quarter, year over year, um, and always have the ability to see what the market's doing.
Yeah. And I think my final thought on the whole thing is there's a lot of different ways to do that. There's a lot of data out there that can give you that full view of the market. Internal data, I think Sean and I would both say that there's varying degrees of internal data. There's some organizations that do it very well. There's some organizations that do it not so well. I think you agree with that, Sean.
Yeah, listen, I'm biased towards internal data. If you do it right,
Yeah.
it's a great resource. If you don't, it's detrimental.
Yeah. Well, and then because of a lot of the shakeups that we're seeing in the market, we're seeing a lot of cobbled together systems, right? They acquired a small healthcare system. They're trying to, over time merge it with whatever existing EMR and various data systems that they have. But that takes time. And I think the age of these large healthcare systems moving slowly to respond to market dynamics just isn't going to fly anymore.
Yeah,
Because it's changing too quickly. And if you don't change, you're going to be missing you're going to be missing revenue opportunities, right?
without
Um,
a doubt. And I'll leave everyone with this: is internal data can get you so far. It,
yep,
it, it allows you to understand what you're getting, what your organization is doing. But what it does not allow you to do is look around the corner at market opportunity, competitor dynamics, physician behavior outside your network. So having a good data source with data that's aligned to specifically steer you to your opportunities is a critical asset to have.
yep. There's a lot of data out there, but I think we do it better than most, Sean. And if any of you folks are curious and seeing what we're talking about and seeing a demo just to kind of see how we can show you the journey of where your patients are going with our data and with the data that you probably aren't getting internally, we'd love to set up a demo for you. Any other final thoughts, Sean?
I think we covered a lot rather quickly. Um,
Yep.
Again, we could talk about this for a long time, but we're
Sure,
looking
good.
forward to hearing from everyone and your questions.
Thanks, everyone.
Thank you.